My name is Macfadyen. I'm a specialist recovery practitioner. I'm actually an occupational therapist by training, and I work in the Central Bristol Recovery and Assessment Service. There's sort of different bits of my role, so it's probably worth me putting my role in context of other people in the team. So the different sort of people in the role, we have recovery navigators who are sort of really senior support workers with lots of experience usually. Then we have recovery practitioners who are people who have a degree in either nursing, social work or occupational therapy. And then we have specialist recovery practitioners who are people who are sort of the next level up, which is myself. So that's kind of where I fit in the team. In terms of my role, the kind of biggest part of my role, which is similar to the other people in the team, is that I have a caseload of people that I see regularly, and I am officially their care coordinator. And what that means is I'm the sort of first point of contact within the team and within the service for them to come to, and in terms of making referrals and that sort of thing. So I'm the named person for that person who would work with them and liaise with other people as needed. So that's one part of my role. Another part is as a specialist recovery practitioner, I provide supervision to a lot of my colleagues. So I supervise quite a few different people, both occupational therapists and recovery navigators. I also am part of providing assessments within the team. So the team is a assessment and recovery team. The assessment bit is when people come into mental health services, we spend time finding out about their life, what's working, what's not, what difficulties they might have, what makes things easier for them, what helps, what support they've got, and that's all part of an assessment of their mental health. So we do some of them. We have specific assessment workers who just do assessments, but that's just a small part of my role. Mostly I care coordinate. And then another part of my role is I'm also part of a particular therapy service, which is called dialectical behaviour therapy, and it's a particular type of therapy. So I'm also involved in that team, and I do that every couple of weeks. I help run a group and work with people one-to-one as well. The way I think of assessment and recovery is that we are there to help people make sense of what's going on in their lives and how that's affecting their mental health. So a big part of that is, I feel, is to help recognise what's happened in their life or what's happening currently now that is affecting their current mental health. So it's recognising the link between past and present and situations and what actually happens and how you feel and how you react to that. So we help people in terms of providing support, providing someone that they can talk to. We can also make referrals to our psychology colleagues. They have a complex name, but they're basically psychological therapies. So we can make referrals to them, and the team that I also work as part of is part of that service. The dialectical behaviour therapy team is part of psychological therapies. So we can also make referrals to other organisations within Bristol Mental Health, so wider referrals who can work alongside us. And we're there, I guess, to help people look at what their goals are. It doesn't really matter what our goals are, it's what their goals are, and to help them work towards those goals. And that might involve doing bits of psychological work with them. It could be looking at their social situation, helping them with that. It could be making a referral to a drug and alcohol service, working alongside them. It could be working with a particular part of Bristol Mental Health, for instance, the employment and support service, so we can do referrals to them as well. And there's probably stuff about them, but they help people either stay in work or get back to work. But specifically helping them around mental health as well and how that impacts on work. So there's lots of work we can do in terms of working with other organisations. We also have kind of, opportunities. Well, it's the key part of our role is to work with people that support the person. So it's not just about services. That's one bit of the most important people, really, I think, are the people like family, carers, partners, friends, relatives, and quite often they're sometimes in the past maybe have been a bit excluded, and I think that's changing. So I think there's a much better recognition now that we need to look at people in the context of their social networks as well and support those people to a degree as well, and we have bits that can support people as well. We can refer someone who's a carer, we can refer for a carer's assessment. That's one thing that might identify various things that might be helpful, but we can also refer them to another part of Bristol Mental Health that has groups for people and also provides one-to-one sessions for people who are carers, because I think there's a big recognition that actually supporting someone with mental health problems can be very stressful in itself for the person supporting them. So those are the things we can do in terms of carer support. In terms of clients or service users, people coming into the system, the service, and it does feel like a system sometimes, so we have to be quite careful not to kind of just remember that actually this is a person who is struggling with certain things, so that's what we try to focus on. So I guess personally, I would meet with someone regularly, offer them a chance to be able to talk about what's going on at the moment, what they're struggling with. Quite a lot of it is around problem solving, so trying to think about what they might be able to do differently, how they might be able to get support either from us or from other services, so coming up with sort of crisis plans and care plans to help people when they're struggling, but to do that maybe when things are a little bit easier for them to kind of put that in place, so then they can follow what they have identified as helpful. Bits of our role are around supporting people for other things, such as, so for instance, I'll write supporting letters to do with if there are problems with someone's benefits, that sort of thing, supporting letter tribunal. We also have to do certain bits of paperwork around the Mental Health Act. So if someone's detained in hospital under the Mental Health Act, then we might have to do certain reports and things if they were going to appeal that decision to be detained, for instance. So that's part of our role as well. We also continue to work with people when they might be in hospital. So if someone's in hospital either informally because they've chosen to go in and that's been agreed, or because they've been detained under the Mental Health Act, I would still go and see them in hospital basically as regularly as I would do anyway. Because one of the big parts of our role, I think, is having that continuity, that there is one person. That's why we have a care coordinator, so that's the same person that hopefully they're going to be there for a while, and other people might come and go from different services, but you've got that one person who provides that continuous relationship, and also for a lot of people can show them that actually it is possible to have a positive relationship. And it's a different kind of relationship to a friend, obviously, we're there as a professional, but it still shows people that actually there are different ways of doing things maybe that can be positive. So. The usual way is to go through your GP. So say someone's struggling, either them or their carer or friend or family could ask for the GP to see them. The GP would then assess at that moment whether they felt they needed extra support. And obviously GPs provide support around mental health as well, but in a more general way. So then what's happened is they would then call triage, which is basically a part of the Bristol Mental Health, who will then do an initial assessment over the phone with someone to sort of see whether they might need extra support. And then they would be booked in for an assessment, and that's normally at one of our particular offices, so mine's at Brookland Hall in St Werburgh's. So we would see them there normally. We can do an assessment at home if there are reasons why it would not be possible for someone to get to the office, obviously. And then depending on that assessment, they might be directed into our bit of the service or somewhere else. We'll see people, well, I suppose I can only speak to myself, but generally I'm aware that my colleagues will also see people kind of wherever is most appropriate. So we can see people at Brookland Hall. I tend to see people in their homes because I think it's helpful to actually see the environment they're in and how that impacts on their mental health as well, which is important. We have other offices, so sometimes I see people at our office in Stokescroft, I see people at Eastfield GP surgery, we can see people at other GP surgeries. I've met people in cafes, I've met people who've gone for a walk. It's kind of whatever's best for that person, really. But generally I would see people in the community most of the time, and sometimes at Brookland Hall. That's quite difficult. Okay, I would say this is how I would describe. I think it is or should be. So it's about three words would be enabling, supporting, and recovery has to be in there. So enabling and supporting recovery, I guess, would be the three words. I would recommend it because of the people that work in it. So the people that work in it tend to be really passionate about trying to support people with mental health difficulties. I think there's a recognition that we all struggle with stuff and that's normal. And like in the rest of life, some of us in the team have had mental health problems and some haven't. Some of us have experience through family or friends, and I think there's a real passion to try and make a difference. And yeah, I think I have great colleagues, and I think, you know, we're really there for the person. It's not perfect, nothing's perfect, but I think that the motivation is really there to support people.